Welcome to Life by Design, episode 390. Welcome to Life by Design. I'm your host, Dr. Kresimir Jug, and I'm not joined today by Dr. Jamie. Just so happens that didn't work out. On today's show, we're going to be covering a study that I'm looking at right now and that I found in arthritis and research therapy on it. And it's an interesting finding. What they found in the study, so they looked at cadavers and they were dissecting the discs in the spine of these cadavers. And what they found was that the discs that were degenerated had more nerve and blood vessels in them than the ones that were healthy, and 50% of the ones that were degenerated had more nerve fibers in them than blood vessel fibers. And it almost seems, contradictory. It would seem, at least I would think of it as, it would seem logical that the healthy discs have both more nerve and blood vessels, and the ones that are degenerated would have the least. So, it's really interesting. And of course, they were looking at non-specific low back pain. And the difference between non-specific and specific low back pain is specific low back pain is caused by another condition like cancer, infection. There's reasons why, and we know, why the cause or what the cause of the back pain is. I mean, it's really easy to understand that if you have a tumor in your vertebrae, that could be causing you pain. Non-specific low back pain is the most common. I think the study mentions, and I think the research is telling us that 80% of back pain that people experience. And by the way, between 80 and 90% of people are going to experience back pain sometime in their life. And of those people, the vast majority experience non-specific low back pain. So we're not sure of the cause. So these studies are all, trying to look at what causes this. It's low back pain is, if I remember reading it correctly, the number one cause of debilitating, or the number one cause that people miss work. So it's a big issue. So understanding it and knowing what to do about it is really important. So the authors really didn't know how to, or what conclusions to make from this study. But when I see it, it's interesting how it fits into how we tend to view the world through Life by Design. So for us, and I mean, this isn't just us that think this way, but your body is designed to heal, right? And when we look at your body, it's really only the creation of new life that your body does, which is responsible for all healing, right? If you were to cut yourself, let's take a look at the most simple type of injury. If you were to cut yourself, eventually over time, what your body would do is new cells would grow back and the cut would stop. So if once you cut yourself, your nerve system brings more platelets and white blood cells to the area, and there's inflammation, and all that's there to clean out the cut and to make sure that everything heals up. And of course, there's limitations to this, right? Like my body can heal a cut, but if I were to cut off my arm, it's too great of a limitation. So the matter's been damaged to the point where, as good as my body is at healing, it can't heal something like that. And then there's the idea of time. Some injuries are very easy to heal and some injuries take time. And when we're talking about the discs, cartilage, which, and interestingly, this is where I'm going with the point of today's episode, cartilage, which doesn't have a lot of nerve innervation or blood flow innervation, takes a really, really long time to heal. Sometimes And in some joints, like your knee or your hip, the cartilage never heals. Once it's busted, it never heals. But the point is we understand, right? Life by Design, or third paradigm chiropractic, understands that it's your body that does the healing. So all of the steps in Life by Design, eat by design, eating real food and moving your body, and think by design, making sure you're following a purpose and a passion. All those things are created to remove all of the negatives from your life and let your body heal and interact as well as it possibly can. So it's really interesting. I just finished telling you that cartilage doesn't have a very good blood supply or nerve system supply. So it's interesting that in the study, when they were looking at the healthy discs, which are cartilaginous, didn't have much nerve supply or blood supply. But when they started to break down, what started happening was the ingrowth of nerve supply and blood supply increased, particularly nerve system supply. Now, it would be interesting to see, because the discs are very dense cartilage. Maybe it took a long time for the nerves to grow in them. But to me, it looks like these are signs that the body is trying to heal these areas that are broken. And when we look at, and I know that there's a lot of questions around this, but when we look at low back injury, most often low back injuries and degeneration are caused by small improper mechanical pressure applied unevenly to the spine, which results in breakdown. So this isn't something where just because you bend over and you tweak your back or you pull something, the injury really didn't happen then. The injury happened because you've been bending over multiple times incorrectly for many, many years. So there's the uneven stress on the disc, and then what happens is things break down, and then you get the injury, right? Then the disc herniation happens, or the arthritis or the degeneration starts to happen. We know that degeneration is depending on how severe, is at least a 10-year process in the body. So it would be really interesting to see and to know when these blood vessels and when these nerves start to make their way into the disc. And again, I don't have the evidence to back this up, and there's no reason to be able to conclude this from the study, but based on what I know and what I believe, my hypothesis is that this is your body's attempt to try to heal these different structures. And of course, healing is possible, right? There are people who have had severely herniated discs, and even degeneration. Not that the degeneration has recovered, but there's people who have degenerated spines who are asymptomatic and or moving at a relatively high level. So in terms of what this information means clinically, the one thing that I'd like you to consider, and the one thing that I think is important, is we talk about the factor of time. This is especially prominent in chiropractic, especially corrective chiropractic or Life by Design chiropractic. There's this idea that, one or two corrections or checkups from a chiropractor is all that's necessary, or that it's all that it's going to take to fix a problem. And if you're not well in one or two visits, well then, there's no place for chiropractic in your life. And definitely it's different case by case. So this is why a thorough examination is really important. We want to make sure that we're getting to the bottom of what's happening and what is necessary, because there's probably other things you're going to need to do in order for your spine to heal, other than the importance of having your spine checked and corrected. But the point is, these are long, slow processes that happen. So my whole point, and I'm going to wrap up with this, something for you to consider clinically, is if you're going through this, please, please, please be patient enough for healing to actually take place. Like I said, the data that I've read says that discs can take 9 to 12 months to be able to heal. So you're looking, unfortunately, at an injury that could take some time. So patience is of the virtue. And when we see, studies like this where the degenerated discs, and it would be interesting if they, again, another question to ask, but it would be super interesting if they ranked the amount of degeneration, if it was proportional to the amount of blood vessels and nerve system fiber or nerve fibers that were found in them. So, but my point for today is healing takes time. There's evidence that your body can heal or is trying to heal all types of injuries that you have. Give your body some time, give it what it needs, and hopefully if you do that and if you do it for long enough, good things are going to happen. This has been Dr. Cray Show. Make sure you guys are joining the drive to 1 million families worldwide living life by design.